first, I got to start with some big thank yous because of the situation we had last year. Now I'm an employee of Columbus Community Hospital, and a lot of people did a lot of work and made phone calls on my behalf to make that happen and put up money. And so I just want to take a minute publicly to thank those people. Booster Club obviously is number one. Also, I want to thank the Board of Ed because, you know, it's to make a big decision financially like that takes some time usually, and unfortunately we didn't really have that. And they worked hard and met extra and did things like that to discuss that and come together with a plan to put that in place. So I wanted to be sure and thank them. It's been a really humbling experience to see the community support for me personally, but also for athletic training. You know, it's kind of a behind-the-scenes job, but you know, to see the support for that was really humbling for me. So I want to say thank you to the community of Pierce. And last but not least, Dr. Lane, Hanke, and Kelsey Kreiner downtown at Pierce Family Medicine, the folks at Avera, they do a great job as far as medical care in a small community like this. You got some really good ones. So, you know, I enjoy working with them, you know, and they give you great care and speedy care, which as an athlete is important. You got to get back soon if you can, right? So they do a good job of that, seeing you the same day or next day, and so I want to thank them for that. Just a little bit about Columbus community. You know, it's exciting for me because it's a new program. Their sports medicine program is one of the best in the state. They're very active at the state level. They've got 15 athletic trainers on staff, and they're all really good people, having worked with them as we cross over and play their schools. You know, I see them, get to know them, and they're all really good people and really good athletic trainers, so I'm excited to be part of that group. They've had some resources that are going to be new for us this year, which is going to benefit you and your kids. They have a weather app that we can use that's accurate enough that the military uses it. I thought that was pretty impressive. We have a new concussion program that we're gonna try to test all contact sport athletes, maybe all athletes. We'll see how it goes. 7 through 12, they take a baseline test at the beginning of the year, and then if they should sustain a concussion, they can take a post-test, and then we can compare those results and help to analyze that even better. And so that's exciting. But you know, I also want to make it clear that the care of the student athlete is my goal. Okay, so just because now I'm working for Columbus doesn't mean I'm going to tell you to go to Columbus all the time. Okay, obviously, like I said, Lane and Kelsey have been an excellent resource, and so I'm going to continue to use them if that's where you go. I'm just going to tell you where you need to go and get what you need done, and if that's Columbus, fine. If it's not, that's fine too. So, okay, now the meat of it. LD 260 Concussion Awareness Act. Every year, annually, it's required by the state that the school district provide you information about concussions, how we're going to handle them, and what you should look for, what you should do should your son or daughter sustain a concussion. First is the education piece, which is why you're sitting here tonight. Second one is removal. Any reasonably suspected concussion, meaning signs and symptoms are, you know, headache, dizziness, nausea, irritability, vision issues, you know, just to name a few. Obviously, there's many more. But any reasonably suspected concussion has to be removed from play that day and not returned that same day until they're evaluated by a licensed healthcare professional, meaning MD, nurse practitioner, PA, or athletic trainer. What I'll do then is I'm going to notify you that your son or daughter had a suspected head injury. This is how we're going to treat it. Either we're going to just wait and see till tomorrow, or we need to do something tonight, or whatever the case may be. Notify our concussion management team, which is here in the building. One component of the Concussion Awareness Act is the return to learn. So that includes some classroom modifications as needed, based on a case-by-case basis, so that you don't have to take a huge semester test the day after you can't remember where where you were playing or the score or whatever, right? And that doesn't make sense. So we'll work with the instructors and Mr. Bramer to make those modifications as needed. And then obviously daily monitoring by me or your healthcare provider, whichever you should choose. After the return to learn and the modifications are done in the classroom, or maybe they're not even needed, hopefully, there's a 5-step progression back to activity, which will be under my supervision, hopefully, or your healthcare professional supervision. And finally, the written and signed clearance by your healthcare provider. So once you fulfill the return to play protocol, then the written and signed clearance by your healthcare provider will be signed by them, by you, and by the student athlete saying, yep, we did this, everybody understands that we went through all this, and now we're ready to go. Okay, so finally, there will be some information on the school webpage where you'll find this video that you have to watch and sign the sheet that proves you were here or that you saw it. There'll be some more information on the webpage if you want to go there. But also with the new concussion software, your son or daughter that takes that test will also watch a video that explains all this as well. So you're going to get plenty of information thrown your way. One thing to note on the software program, obviously it's nice to have, but I'm still going to rely heavily on my clinical diagnosis as well. You know, it's just a tool to kind of help me analyze things better so that hopefully we can give you, your son or daughter better care. Finally, a couple things to note, just some housekeeping items. If you go to the doctor, you don't see me, or it's on a weekend, or whatever the case may be, and they write a note that says you're out of practice, you will have to have another note that says either a specific date or your child may return on this specific time without restrictions. Kind of the wording is important due to the legality for the school district and all that. So if you go to the doctor, you're going to have to maybe make the phone call to their office when they're feeling better or they're getting better, or they work with me and say, yeah, you're ready, but I can't send you back till the doctor says it's okay. You've got another note that clears them, definitely at the end. If you don't go to the doctor, we don't have to jump through all those hoops, but sometimes that's necessary. And finally, there's 2 small sheets out in the lobby. One of them is this concussion presentation. You were here, you sign it. Yep, I understand. I got my information. The other one is for me. It's a medical consent form, and it just, says you give me your consent to treat your son or daughter should the need arise, as well as I can talk to the coach or official or whoever is necessary. I can go down to the coffee shop and tell everybody about your son or daughter's injury, but I can tell the coach, I can tell the administration, whoever needs to know about that injury so that we can work better together. Okay, and finally, if you need anything, this is quick and dirty. Talk to me in the lobby, call me, text me, let me know if there's a question about something. I'm happy to help. That's what I'm here for. So, thank you very much.